Good morning. It's Dr. Jeffreys again on Thy Precious Jewels Health Talk. This morning I'll be talking to you about cervical smear. For the ladies who are wondering what a cervix is, every woman, or almost every woman, is born with a womb. And right at the neck of the womb is a cervix. This is the area that connects the womb into the vagina, which leads into the outside. Now, the cervix is a very important part of the woman's body. Even though usually we don't feel it, and we're not even aware of its presence. But it is an area that can get a disease, which can affect the whole body. Now, the cervix is exposed to the harsher conditions of the vagina. Meanwhile, the inside of the womb is very fragile. When a part of the body that is fragile is exposed to harsh conditions, that part of the body can change. If you have a change in the cells of the cervix, and this remains so for a long period of time, it can make the cells to turn outrightly abnormal. And these outrightly abnormal cells can develop at a very fast rate. And they can spread their abnormality into the cells around them. And that is what a cancer is. Now, how do you know what is happening to your cervix? That's where the talk today comes in. Every woman who is above the age of 25 should have a smear test done. The smear test does not diagnose cancer. The smear test picks the abnormal cells that I described earlier on. Some of the cells, if left alone, could develop into cancer. So what we aim to do is to find them early and take them out before they have the opportunity to become abnormal enough to cause any trouble for you. How is the cervical smear test done? If you're in developed countries of the world, usually you will get an invitation to come and have your smear test done. Usually you need to book an appointment with your doctor where the receptionist would ask you what day of your period or your cycle you're in, and they will be able to arrange a suitable date for you, because this test has got to be done on some particular days when the secretions from down below are clear enough and there isn't anything that should affect the readings or the results. It's as simple as you going in, having a lie down. They do exactly what they would do when you're having a swab test done. They will just take a very nice sweep around the cervix. It is a bit uncomfortable, but I must say that for a sexually active woman, you have been through much more uncomfortable situations. It's not something that will bring you to tears at all. You can even take a friend with you to hold your hands if you think that it's going to be really scary. Don't worry, a lot of women feel the same way. Now, once they've taken this swab from around the cervix, they send it off to the labs in a very special solution. And the specialist in the labs would have a look at it. They may even find out if you have an infection that you didn't know you had. Most of the time, the results come back normal. If it is normal, that means you don't really have to bother about doing the same test for at least 3 years. If it is abnormal, depending on how abnormal it is, because there are different degrees, there is a mild problem, there is a moderate problem, there is a severe problem. Depending on what has been found, your doctor can then arrange for you to have a follow-up. The follow-up could be for 3 years, it could be for 6 months, it could even be that they want you to have a yearly test. Whatever they found, they will deal with it. I would like to encourage my sisters to please go and have a smear test done. You don't know what is happening down there. Most people who have abnormal smears do not feel anything. Most of them do not have any symptoms at all. If left alone, the abnormal smears tend to develop into cancer on the long run. There is no point in leaving it to chance. Are you a sexually active woman? You need a smear test if you haven't had one. You may even say that you're a widow, or that you used to be sexually active, but now you don't have any man in your life. If you have ever slept with a man, then you do need a smear test. Until tomorrow, when I'll be talking a bit more about abnormal smear tests, it's Dr. Omobola Jeffreys on behalf of Thy Precious Jewels. If you have any questions you would like us to answer, please send an email to thypreciousjewels@googlemail.com. Your body is your responsibility. Take good care of it. Good morning.